This is Dr. Mark Russell, preventive medicine physician in Tucson, Arizona, CD2, and I'm here again to answer some questions that have come up over the last 10 days or so since our previous video, and I would like to thank Brandon Martin for giving me the opportunity to come back and address some of the issues and the concerns that residents in CD2 have had, and I'd like to address those not just with respect to Southern Arizona, but also with respect to the entire country, because this is a very critical issue. And we've got a number of questions that folks have presented to us to address, and so I'm going to go through some of these questions and try to answer and respond to the concerns folks have for this. The first point I'd like to address is what things have changed since our last video. What do we see that's occurred? And I think probably the most important thing is that the number of cases that we have in this country have begun to decrease significantly. And along with that, the number of daily deaths that have occurred across the country are beginning to plateau and, in fact, tail off. As of today, we're probably have now 5 or 6 days of basically flat deaths, if not decreasing. And we can see that we're finally reaching a point that I think we can call this gaining control of the epidemic. The initial projections for the number of deaths with this epidemic have been dramatically revised downward, and I'll talk about that in a minute in another question. But along with the epidemic coming under some measure of control, the actions that we've taken have created some unbelievable and dramatic and devastating results on our economy and on our country. And we can talk a little bit about that. We now have 20 million people that have filed unemployment claims in this country. That's an unbelievable number for that to occur inside 3 weeks based on the actions we took to attempt to mitigate this infection. The issue of the predictions in the numbers of death rates that initially came out. We had initial projections that without any mitigation efforts that the number of deaths in the United States would be upwards of 2 million people. The projections were that even with mitigation, we would still have somewhere between 100 to 150,000 people die from this infection. This is in a country of 330 some odd million people. The initial projections were made on models that were incomplete, were an attempt to model using previous epidemics from other viral infections that had occurred in the last 50 years or so. And then they were adapted and modified using some of the early results from the other countries in Europe, particularly Italy, where the population has dramatically different demographics than what we have in the United States. The results of these projections and measuring them against actually what was occurring, it did not take more than maybe 10 days or so for some of those projections to be called into question. Dr. Fauci has recently then reduced the numbers initially to 100 to 240,000 deaths. That was one of the initial reductions. There was then another reduction down to somewhere between 40 and 180 some odd thousand deaths. And then again, more recently, approximately 5 days ago, the projection was 80,000 deaths. Now, the latest thing that I've seen, and I don't know if this is actually from Dr. Fauci, but the latest projections are somewhere around 60,000 deaths. And I would point out that that is approximately what we would define as a moderately severe flu season in the 60,000 death range. The hospitalization requirements, all the equipment, the DME requirements, the durable medical equipment, the ventilators, all the associated needs for all that were were wildly overestimated. Anyone who has family or friends that's employed in the healthcare industry right now knows that other than in those few hotspots, such as New York City, some of the bigger cities in New Jersey, Detroit, probably Michigan, if you look at Michigan's number and Louisiana's numbers, the bigger cities in those areas are hotspots and have had higher numbers, but 95% of the country has not had the impact that was projected. Even in our city of Tucson, we have hospitals who are preparing to lay off employees because there are literally no patients to be treated. They've had a couple of handfuls of COVID patients. The state has had 100 some odd deaths through this whole thing at this point in a population of 7+ million people. We just have not had the impact to our state that was projected. And I think the national projections, that's a reflection of the fact that the estimations were greater than they should have been. Not to diminish the fact that any death is a terrible death and that we shouldn't have those. We don't want anyone to die from any disease. But perspective matters here, and we have to look and compare and consider other causes of death and make comparisons from those. Particularly influenza, I think, is a very applicable measure to compare to because of the similarities in how the virus is spread and how we control it as an epidemic itself. Final comment I would make regarding the numbers and what we've seen with the projections of the epidemic are that we will need an intensive review of the infection and how it was handled, of the entire process of review of the infections, the entire actions taken, all of both the federal, the state level. It warrants a very hard look because other infections will occur. We will have other viral epidemics that occur across this country and even in states in smaller geographies than perhaps the whole nation. And so we should learn something by how we handled this and hopefully be more prepared and be able to do a better job at projecting, because the ramifications of the actions we've taken, I think, are yet to be seen. We already can tell it's going to have a huge negative impact on our country. We have recommendations now that people in some cities and some states are making recommendations and in some cases making requirements that people wear masks anytime they're in the public. My comments are that, and observations are that initially we believed that this virus only transmitted by droplet transmission, which means that it didn't aerosolize into the air and you couldn't transmit it by just being in the near vicinity of someone and breathing the air that they had exhaled. I think the initial recommendations were that only people that were working in close contact, such as in healthcare, should be wearing a mask. Through the course of this epidemic, more information has been learned, and we know that now it can be transmitted via aerosolized transfer. That's important because that gives us a reason for people to wear masks when they're in public, and the recommendations have been changed. I believe it's important that people consider wearing masks, and most importantly, I believe that people that are high risk for complications of having this infection wear masks, and certainly anyone in healthcare. The initial supplies for personal protective equipment were very limited. I think it was appropriate initially when we didn't have adequate supplies to limit those to the healthcare workers who most required them and needed them. But I think it's now, supplies are at the point now and people are beginning to make their own masks, and various companies have ramped up production. So I think it's a reasonable thing when an infection like this is active in one of your communities that you would consider wearing a mask if you have a lot of risk factors. Another question that has been asked, and I've received emails and social media contacts near every day, is regarding the use of hydrochloroquine as a treatment for this infection. The media and President Trump have had an ongoing dialogue, if you will, regarding the use of this drug in combination with Zithromax, which is what we clinicians are using it with. Comment I have to make is that this is a drug that was being used from the outset of this infection across the world as a treatment for this infection. We knew, dating back to the early 2000s, that hydrochloroquine had some immune augmenting effects for the SARS virus, which is a coronavirus, which was an infection that the world dealt with back around the year 2000. As soon as this epidemic popped up, physicians began using it. And I don't think everyone was aware of that. And we mentioned it in our first interview that physicians could use it off-label. And they have been. They've been prescribing it for people. Most anyone that has even a significantly serious infection is receiving hydrochloroquine and Zithromax as a treatment. In some cases, it seems to be working remarkably well. In other cases, it doesn't. So we do need the studies that Dr. Fauci recommended in order to determine whether or not this is truly as beneficial as it appears to be at this juncture. But people should know that despite all of the media back and forth and the, if you will, the hype surrounding its use and the ramifications of whether the pharmaceutical companies might be making money off of this and promoting it or not promoting it, I think people can be assured that as a physician, I can assure them that clinicians are using this because we believe it's beneficial. And we have no interest in any of the other political issues that surround the use of the drug and what you might be seeing in the media. It's being used, and in some cases, it has absolutely been beneficial for patients that suffer from this infection. The other question I think that has been bandied about is the safety of the drug. We should discuss that momentarily. This is a safe drug. In some countries where malaria is present, it's being given to millions of people. It has side effects. They're minimal. They're not serious. For the most part, I would put this in the classification of very safe. And so, despite what you might read in the media, if you or a family member or a friend is prescribed the drug, I think you can rest assured that we're writing the prescription and we're administering it appropriately with the expectation that it's going to be safe for you to use and it's going to benefit you with respect to a COVID infection. What will our country look like as we begin to come out of this epidemic? All the indications are that we've plateaued and we are at a point where we can see improvement in the epidemic. So what's it going to look like when we come out? From a clinical perspective, I have to say that we don't know exactly what that's going to look like, just like we didn't know exactly what this epidemic was going to look like at the outset. And so we can make projections. I would say as we begin to come out of this, we're going to see a few hot spots around the country. We're going to see some of the big cities where people truly are in close proximity, high density populations. We'll see a few hot spots that'll need to continue to be controlled with aggressive measures as far as social distancing and isolation, quarantines for people that are testing positive, those same sorts of things we're doing nationally right now. The majority of the country, when you look at the area of the country, and particularly some of the western states that have very limited infections and have had a very limited impact from this epidemic, we need to consider getting those states and those folks back into a normal life. How that will look ultimately, like I say, we don't really know. But we have to get this economy going again. We have to get our country up and running again. And I truly hope that our leaders, President Trump, the governors of all the states across our country, are beginning to make those kinds of plans. They'll hopefully consult the appropriate experts and subject matter experts that can help with this and consider both economic factors as well as clinical and public health factors and make recommendations. There's been some absolutely absurd recommendations that we can continue the lockdown for, in one case I heard 18 months. There's no clinical justification for that. I don't know where we could ever believe that to be the case. We need to begin to open the country back up. We need to be nimble and ready to address any hotspots that pop up, and then we need to act appropriately when they do. But the majority of the country is able and ready to open up. This epidemic is controlled at this juncture, and we can see that it's on the downswing now. To address a couple of questions regarding how we've been tracking the progress of the epidemic. The measures initially that were talked about and were publicized had to do with the number of cases that were being identified of COVID. And it's important to recognize that even today, we have really not been able to get enough test kits out to be able to test all the people that might have symptoms of COVID. We're doing a much better job and we're identifying a lot more of the cases. But as far as how we're doing at identifying every potential case of COVID, we're still limited on that. So when we go to make determinations on the progress of the epidemic, we need to find measures that allow us to judge where we are. And the key measure that I have advocated that we use is the new daily deaths. In other words, we want to see how many people have died from the infection on each day. And we would know that when that begins to flatten and that begins to go down, that we've actually reached the plateau and we're beginning to go down in the number of deaths. So that we have reached that. We've plateaued down for about a week. The reason that we could never really use the new case identifications was because we weren't finding them. That's been kind of a weak measure as far as reliability for how the epidemic has progressed. Unfortunately, even the new daily death rate has been tainted somewhat now because we're finding out that I think physicians have recognized that there's now been some guidance provided by the CDC that is allowing physicians and providers to identify an infection merely from clinical grounds as COVID. I want to say that I believe that's an error. I believe that we need to be test proving COVID before we label a death being due to COVID. Unfortunately, I think that calls the death rate into a little bit of question, and I think people have probably been hearing some of that question in social media and media otherwise. I just want to point out that while new daily deaths is, in my estimation, the best measure to see how we're doing, there has been some shadows, I guess, cast on the quality of that measure. Even given that, I still think it is probably our best measure for determining where we are in the epidemic progress, and I believe that we are plateaued and actually beginning to tail down on new infections for certain, and now the daily deaths, which will lag a couple of weeks. The measures that we take today are no different than the measures we took initially. We need to wash our hands often. These are things we should always do in the winter, particularly when flu season or any other viral infections are increased. When don't touch your face with your hands. If you do, make certain that you wash your hands after doing so. If you're not able to use soap and water, hand sanitizers are the best alternative to that, and use those frequently and often. Social distancing until we see this infection completely under control. I believe it's appropriate for people to still consider social distancing. As the numbers begin to tail off for new infections, I think we'll hopefully see some relaxing of those things, and particularly in any business that can reopen that doesn't have absolute close proximity between their patrons and their businesses. We'll be able to bring people back into businesses. We'll be able to open up restaurants with some measure of social distancing, and other businesses where that's an issue. The recommendations that we made at the time of the first video at the outbreak of this epidemic have not changed in any fashion. I think that good hand washing, good hygiene, those measures are just as important today as they were at the outset or even before this epidemic. I hope some of these questions were useful. These answers to these questions were useful. I hope that everyone will continue to do their part to help with this epidemic, and we begin to see the improvement in the numbers that we've seen over the last week or so. Hopefully our state, our community, and our nation can return to some normalcy as soon as possible.